application. Okay, so we have here Don Patrick Del Rosario. Hello, Patrick. Patrick is watching right now from the Philippines. Hi, Patrick. Okay, great day, right? And for the radiation therapy, the focus is often, okay, on the safety precautions, right? Okay, about the client education and managing the side effect of your radiation. So things you absolutely must know to protect both your patient and yourself. Yes or no? Yes. So in the next hour, we're going to break down these two major cancer treatment, okay, in a way that's simple, memorable, and of course aligned with NCLEX test taking strategies. Okay, and by the end of our session, you will feel more confident, right, answering these questions correctly on your exam day. Are you ready? Okay, so let's talk about your surgery. Okay, so when we talk about of your surgery, as yes, we all know that surgery is the primary modality of treatment when it comes to cancer, right? But it's very, very important that you know, right? In oncology nursing, okay, surgery is not always about removing a tumor. Okay, it can serve different purposes. Okay, and NCLEX loves to test if you know the difference, right? So first we have what? Okay, we have, okay, for the purpose, we have very good the diagnostic. Okay, the diagnostic. So when we talk about of your diagnostic, what is this? Okay, diagnostic purposes. Okay, the diagnostic surgery. So this is when we take a tissue sample, like, yes, very good, in a biopsy, right? Okay, to confirm the type and stage of the cancer. Next, we have what we call your, okay, very good, your curative surgery. Okay, your curative surgery, what is this thing? So this is when the tumor is localized and can be completely removed. Okay, so giving the patient the best chance, okay, at cure. Next, another purpose of your surgery is the palliative surgery. Okay, then what is this palliative surgery? Okay, what is this palliative surgery? Okay, so this is not to cure the disease, no, but to relieve symptoms and improve the quality of life. Okay, so for example, removing a mass, okay, that's causing pain or obstruction, right? Okay, very good. And finally, we have the preventive. Very good. Okay, the preventive. Okay, the preventive. Okay, preventive, or this one is also your prophylactic surgery. So this is when we remove tissue that is not yet cancerous, but yes, has a very high risk of becoming malignant. Okay, but I would like to add, yes, another purpose is the reconstructive surgery. Okay, reconstructive. Okay, reconstructive. Okay, reconstructive. Okay, what is this thing? So this is done to restore function or appearance. Okay, like breast reconstruction after, okay, the mastectomy, right? Okay, so we have two major topics when it comes to your surgery, okay, for your oncologic nursing. Okay, so we have, yes, NCLEX, okay, the NCLEX loves to test about the breast surgery. Okay, the breast surgery. So let's talk about of the breast surgery post-op. Okay, so what are the key points here that we need to study? Okay, what are those? All right. Okay, two of the most common types of your breast surgery post-op is what we call your lumpectomy. Okay, your lumpectomy and your mastectomy. Okay. And if NCLEX would ask you, okay, what is the main complication that we are going to watch out for? What is that? Anyone? Anyone? Hoy. What is the main complication that we are going to watch out for, okay, post-op breast surgery? Anyone? I'm checking our chat box here. Okay, so feel free to type your answers. Okay, what is the main complication of post-op breast surgery? Starts with letter L. What is that? That is your, okay, okay, we need to watch out for. Very good. That is your lymphedema. Very good. Your lymphedema. Okay, so when we talk about of your lymphedema, that's swelling in the arm due to what? What's the cause of lymphedema? Okay, due to lymph node removal or disruption. Very good. Okay, so teen, how are we going to prevent lymphedema? Okay, because this is the complication that we are going to watch out for. So we will be expecting that NCLEX will test, okay, your skill, your knowledge about this one. Right? Okay, so how do we prevent the lymphedema? Number one, okay, it's very important to what? Instruct patient, okay, or yes, the registered nurse assign, okay, to what? For example, you're supervising a new RN, something like that, no? Okay, it's very important to have a health teaching, okay, that focuses on, okay, very good, elevation of the operative arm, okay, so meaning elevate, okay, elevate the operative. Okay, very good. The operative arm. Okay, so above, okay, that's the above. Okay, above heart level to help, okay, very good fluid drain. Okay, next, okay, can we take blood pressure on the operative arm? Okay, no. Okay, yeah, so no blood pressure. How about in IV line? Okay, no IV lines, ha? No IV lines. What else? Okay, so anything, okay, that there's a manipulation or an invasive procedure to the operative arm, it's a big no-no. Okay, like venipuncture, no. Okay, venipuncture, no. Right? So take note of this one, ha? Okay. Next, okay. Next, what else? We can also include maintain a gentle compression, ano? Okay, yes. Maintain a gentle compression. We can also include that. Just gentle. Okay, gentle compression. Okay, another one, okay, we can also instruct the patient, okay, to perform what? Gentle arm exercises, okay. Include this one, gentle arm exercises. Okay, so what's rational to promote venous return? But always start, okay, highlight this gradually and only as prescribed. All right, take note of that one, ha? Okay, how about if the patient, okay, is for discharge? Of course, it's very important to focus on the discharge instruction, okay? What are you going to instruct your patient, okay, during it, okay, discharge, okay, discharge instructions. Okay. We will include, okay, instruct your patient, no heavy lifting. Okay, very good. Okay, no, okay, heavy lifting. Okay, teen, so meaning anything that is heavy, considered as a big no-no, yes. Okay, and how are you going to consider that it is already a heavy lifting? Okay, so nothing over, okay, very good, 5 pounds. Okay, nothing over 5 pounds. Take note of this one, okay? So what else? Instruct your patient, okay, very good, to put insect repellent, okay, insect repellent. Okay, so what's the reason? To avoid bites, because yes, that could lead to a possible infections. Okay, what else? Avoid activities, okay, that could injure the arm. Okay, activities, okay, that could injure, okay, that could injure the arm. Take note of this one, ha. For example, things like gardening, okay, contact sport, even sewing, no, cooking, yes, all right, until cleared by, okay, the physician. Okay, so take note of this one. And clicks loves to ask question like, okay, so which action by the nurse, okay, is correct in preventing lymphedema? Or what instruction is priority for post mastectomy client? Okay, so what will be your answer? Okay, so anything that reflects, protecting the arm, especially the operative arm from injury, and avoid all procedures, okay, on that side. Take note of that one. Okay, so pipi taking, IV lines, venipuncture, yes. Okay, avoid all procedure on that side, the operative side or the operative arm. Take note of that one, right? So that is for your, very good, okay, your post-op breast surgery. Okay, now let's proceed to your, okay, very good, your lung surgery post-op. I hope everything is clear now. Okay, so it's very, very important to talk about of this, right? So we have different types of your lung surgery that you might encounter on your upcoming NCLEX RN examination. So we have your lobectomy, okay, your lobectomy. Okay, so what is this? This one is the removal of, very good, a long lobe. Okay, removal of long lobe. All right, next we also have your segmentectomy. All right, so this one is the removal of a segment. Okay, removal of a segment. Next, we also have your wedge resection. Okay, teen, what is this? Your wedge resection is the removal of small, what else? Localized piece, often for biopsy. Okay, often for biopsy. And we have your pneumonectomy. Okay, or pneumonectomy. All right, so what is this thing? This one is the removal of, okay, very good, an entire lung. Okay, removal of an entire lung. Take note of this one, right? So NCLEX loves to ask about the positioning because positioning is key, no? And NCLEX, yes, okay, loves this detail. Take note of that one, right? So highlight this. Okay, so this is the NCLEX tip. Okay, so for your lobectomy, for your okay, hold on. For your lobectomy, okay, what else? For your segmentectomy and also for your wedge resection, okay, it's very important that we note this. Place the client on semi-fowler. Okay, we will place the patient in semi-fowler and they may lie. Okay, and let's love the test about this, ha? Okay, and they may lie on the unaffected side. Okay, position in the unaffected side, right? So this is the keyword. We will position the patient in unaffected site. What's rational? To promote lung expansion. And for procedure, pneumonectomy, yes, they may lie on, very good, on the affected. Okay, on the affected. So meaning, teen, we're talking about of the, very good, operative site. Okay, the affected or operative site. Okay, so why? Because this allows the space to fill with fluid and helps prevent mediastinal shift. Okay, so keywords. Okay, anything that reflects for your pneumonectomy will position the patient on the affected side. That's it, right? So for the rest of the procedures, we'll position the patient on affected side. All right, and take note, semi-fowler, right, kids? Okay, and we also have here some chest tube conservation, but yes, we have a separate discussion of that one. Okay, you will usually see the chest tube for lobectomy, yes, segmentectomy, and wedge resection, right? Okay, take note of this one, chest tube, right? And for your pneumonectomy, most of the time, okay, take note of this. Take note of this one. Most of the time, no chest tube. Okay, most of the time, no chest tube. White tin. Okay, so what's the rational? What's the reason? No? Okay, most of the time, no chest tube is placed because there's nothing to drain. Okay, so the cavity will naturally fill with fluid. All right. Okay, take note of this one. NCLEX love to test about this. Okay, so we can also add some post-op priorities. Okay, so when it comes to your long surgery post-op, it's very important to maintain what? Airway. All right, airway oxygenation first, the hallmark of your prioritization, your ABC, right? Airway, breathing, and circulation. So we have here, hello, this Lord. Okay, hi. Okay, great day po. Right? So aside from maintaining an airway and oxygenation first, it's very important to monitor for bleeding and sign of, very good, your tension pneumothorax, like your tracheal deviation. Okay? So provide a good pain control so the patient can cough and deep breathe. Yes, very good. And encourage early ambulation to prevent pneumonia. Okay? Take note of that one. Take note of the positioning, ha. Okay, NCLEX loves to test, loves to ask about this one. Next, let's talk about your radiation therapy, and it's a promise. Okay, you will encounter this radiation therapy on your upcoming NCLEX RN examination. Okay, so when we talk about of your radiation therapy, what is this? Okay, what is your radiation therapy? So your radiation therapy is, yes, very good. This one is a localized treatment. So meaning if it's localized, it targets specific area to destroy or shrink the tumor, okay, while sparing, okay, very good, the surrounding healthy tissue as much as possible. So this one is localized. And we have two types of your radiation therapy. Can you still remember, okay, the types of your radiation therapy? Okay, hello, Muhammad. Okay, ayan. Muhammad is from Pakistan. Hello. Right? Can you still remember the types of your radiation therapy? Can you please type your answer here in our chat box? Okay, so your radiation therapy has two types. Okay, so we have your, okay, we have your, okay, hello, Muwash. Muwash is from Nigeria. Okay, so the first type of your radiation therapy is what we call your external. Okay, your external. Okay, so this external is also known as your very good teletherapy. Right? So next we have your internal type of your radiation. Okay, the internal, or also known as your brachytherapy. All right, and under internal type of your radiation, we have, okay, so this one can be classified as unsealed, okay, and sealed, okay, and you're sealed, okay. All right, Sika. So let's discuss the difference between your external and internal type of your radiation. So this is a trending topic. Very good, Muwash. That is your external and internal type of your radiation. So first, let's proceed to your external radiation. Okay, so what comes into your mind when we talk about your external radiation? Anyone? External meaning. Okay, question. Is your patient here, okay, radioactive or not? Okay, question. Is your patient radioactive here or not? Okay, I'll wait for your answer. Okay, radioactive or not? Anyone? Okay, for external type of radiation, is your patient radioactive or not? Okay, your patient is? All right. Okay. So, hello, Paul. Hi, Paul. How are you, Paul? So, Paul is from the Philippines. All right. Okay. So, when we talk about of your external type of your radiation, your patient is not radioactive after the treatment. Take note of this one. Your patient is non-radioactive. All right, after the treatment. Okay, so this is important for NCLEX. Why? Because most of the intervention, the nursing key points, the nursing care, all right, we will focus on the skin. Yes or no? Yes. And the procedure is done in a treatment room and is completely painless. All right, completely painless. All right, very good. So yes, Isaac is not radioactive. Very good. Your patient is non-radioactive here. All right. So the most common example of your external radiation is your cobalt therapy. Okay, example, your cobalt, right? Your cobalt therapy. Okay, so this one is in the form of beams, laser. Yes, all right. So many of analysts would ask you, what is our priority here? Of course, aside from the safety of our patient, our nursing focus here. Okay, our nursing focus is all about laser. We're expecting that. Okay, it's external. Think of skin. All right. So our focus is skin protection. All right, so anything that reflects, breaking the skin integrity, compromise in the skin, right? So it's a big no-no. It's very important that we maintain the skin integrity of our patient. Of course, safety, yes, during and after the therapy. Anything that reflects skin protection, that would be the answer. Take note of that one, right? So meaning, aside from the safety of the patient, if, okay, I encounter skincare tips, no? Okay, that is, will focus on maintaining skin integrity, diba? No break on the skin, yes. Walang sugat, uy, ha? Okay, all right, take note of that one. That would be the best answer. Okay, your skincare tips. Okay, your skincare tips. Okay. What are what are those? NCLEX loves loves to ask about the skincare tips, Okay, so it's very important to wash the irradiated area gently with water or mild soap as prescribed. Okay, as prescribed. Again, it should be mild soap. Okay, mild soap, no? Again, only as prescribed by the radiation oncologist. Okay, take note of that one. Hello, Nabila. Okay, Nabila is from Dubai. Okay. Okay, around the globe, right? Okay. And it's very important to wash hands, okay? Okay, wash hands now. But when it comes to washing the hands, okay, of course, you will use soaps, right? Okay, yes. Okay, so it's very important to select soap that is mild, okay? No antimicrobial, right? Yes, no alcohol, especially on, okay, the target area. Take note of that one. Yes, okay. So again, we're protecting the client's skin and reinforcing safety measures during and after the therapy here. Okay, so it's very important to what? Do not remove what? Do not remove, okay, any ink. Okay, do not remove any ink or dye. Whiten, that is the marking, okay, or the tattoo marking, okay, the tattoo marking, right? Why? Because this will guide the radiation beams the exact location. Okay, so anything that reflects breaking the skin integrity, removal of the tattoo or the dye marking, it's a big no-no, right? Okay, how about in the application of the powder, the ointment, the lotion? No. Okay, so it's very, very important to focus on maintaining the skin integrity of the patient. Okay, of course, the use of powders, ointment, lotions, or cream like this one. Okay, so these are nursing management or our focus when it comes to skin protection during the radiation therapy. Okay, yes, you can use, okay, only prescribed by, okay, your oncologist, okay, your radiation oncologist, okay, but okay, anything that that is too harsh in the skin, yes, your antimicrobials, it's a big no-no, right? How about wearing of constrictive clothing? Okay, it's a big no-no, okay, so we will select, okay, very good, soft clothing, okay, avoid this belt, right, the buckles or strap over the treated side. Okay, so like the sun exposure, heat, the extreme temperature. Okay, so this includes avoiding the heat pad, so anything that reflects, okay, that can, that might cause trauma or irritation to the skin, okay, so yes, okay, we will include that, right? So what is our NCLEX tip here? If you get a question, okay, so which instruction is correct for a client receiving external radiation? Okay, the safest answer is what? Anyone? Okay, so let's try. Let's try to answer. Okay, so kindly type your answer here in our chat box. So we have here Maria Khan from Pakistan. Hello. Okay, so if you encountered question, okay, in your NCLEX now, so which instruction is correct for a client receiving external radiation? So what is the safest answer? You can type your answer here in our chat box. Okay, Sika. So try to answer. What is the safest answer? All right, anyone? Okay. What is the safest answer if you encounter, okay, patient receiving external radiation? The safest is anything that reflects what? Protecting the skin, avoiding the sun, the heat, no? And never remove the treatment markings or the dye markings, all right? Very good. So it's very important to eliminate any option that involve, okay, that involve what? Applying random lotion, something like that, scrubbing the skin or exposing the site to sunlight. Okay, so yes, those are unsafe practices during the external radiation. Take note of that one, right? Okay. And our key takeaway for NCLEX external radiation is all about very good, a precise skincare and protecting the treatment field. Okay, so because damaged skin can delay therapy and increase risk, okay, of infection. So always reinforce these points during the client teaching. Take note of that one. All right, very good. Okay, so next, okay, we can now jump into our internal radiation. Okay, so when we talk about the for internal radiation, question, is your patient radioactive or non-radioactive here? Okay, type your answer here in our chat box. Is your patient radioactive or non-radioactive here? Internal radiation, right? Anyone? Okay, all right. Is your patient radioactive or non-radioactive here? Internal radiation. What is your answer? Anyone? Okay. Okay. All right. So maybe yes, there's a bit of delay here. Okay, in Facebook Live. Okay, I don't know what's happening. Yes, so we have response from Isaac. Yes, very good. Okay, so your patient is radioactive here. Okay, yes, client is usually and actually radioactive during the treatment. Okay, radioactive. Take note of this one. Your patient is radioactive here. So this becomes the big safety concern for both healthcare workers and visitor because your patient is radioactive here, right? And we have two main types of your, very good, of your, okay, hold on. Okay, so we have two main types of your internal radiation. First, we have your unsealed. Okay, so when we talk about of your unsealed, what is the skin, right? So when we talk about of your unsealed, all right, so one of the most common example of if you're good, your radioisotopes. Your radioisotopes, like your I-131, so this one is given orally or IV. Okay, so here, okay, so we're expecting tin, huy, ha? Okay, the patient will be given a radioactive thing that will, yes, the patient will take that orally. So we are expecting, yes, that the body fluids like the urine, the saliva, the excreta, right, may be radioactive for a certain period. So meaning the focus here is all about a radioactive excreta, right? Okay, yes, our nursing key points here will focus on that, right? Okay, very good. Okay, take note of that one. Okay, so we need to highlight this. Your patient, okay, will have a radioactive, okay, a radioactive excreta. Okay, so the focus is all about the excreta of your patient. Okay, so it's very important to instruct the patient that the patient will have a separate toilet. Yes, okay. And of course, we're expecting that the patient, okay, will have a separate toilet. So meaning the patient will be yes, isolated for how many days? Yes, instruct the patient. Okay, that he or she will be isolated for how many days? For 5 to 7 days. Very good, right? And instruct that the toilet should be separated, okay, from the family. Okay, from the family. Take note of that one because we're expecting, yes, that the body fluids, the excreta, may be radioactive for a certain period, maybe 1 week. Yes, right? So what else? Okay, instruct your patient, okay, to use what? Use bleach. Okay, very good. Use bleach when cleaning. Very good. Okay, use bleach when cleaning. Okay, how about for flushing the toilet? Instruct the patient to flush the toilet, okay, 2 to 3 times. So what have you noticed? Most of the interventions here, okay, focuses on, okay, very good, the excreta, right? Okay, because we're expecting a radioactive body fluids here, okay? All right, so next we have your, okay, seal type of your radiation, okay? Okay, very good, the seal type. Okay, so when we talk about of your seal type, okay, these are the small implants. Okay, yes, it's in the form of pins. Yes, pins, beads, wires. Yes, these are your implants. Yes, okay, that place directly or near the tumor. So for example, in cervical cancer or prostate cancer. Okay, if it's within the breast tissue, that is your interstitial, and it's intracavitary. Okay, if within the cavity like your cervix, the bladder. Okay, but one of the most common, okay, one of the most common thing that we're going to focus here is all about the dislodgement. Yes or no? Yes. Okay. Tin, why? Why dislodgement is our focus? Because, okay, we all know that this one is, oh yeah, radioactive thing. Okay. So our focus is safety of both health worker and the patient. Okay. So meaning we have what we call, okay, the factors affecting the radiation exposure. The three core safety principles when it comes to your radiation, right? Okay, can you still remember what are those? What are those? Can you still remember your STD? All right, so this one is your shield. Okay, your shield. Okay, so we're talking about the shield, right? So what is our shield here? Okay, so what is our shield here? Okay, very good. Your lead apron. Okay, your lead apron. Okay, and letter T stands for time. Okay, so we're talking about the limit exposure, the patient's radiation source. Okay, so we're talking about of the exposure of the healthcare worker as well. Okay, that is assigned to this patient. Okay, so per shift, it's what? Okay, 30 minutes per shift. Okay, 30 minutes per shift. And letter D stands for distance. Okay, letter D stands for the distance. Okay, and what is the distance? Stay at least, okay, very good, 6 feet away, okay, when possible. It's very, very important, okay, if you are the nurse assigned, okay, wear the dosimeter badge, okay, wear the dosimeter badge. NCLEX loves to ask about this one. Okay, so when we talk about the dosimeter badge, okay, this dosimeter badge will prevent the radiation exposure? The answer is no. All right, this dosimeter badge will not prevent the radiation exposure. Okay, so this will just measure the radiation exposure. All right, so these are, okay, the factors affecting the radiation exposure. So when we talk about of the implant, yes, this is our focus, right? Okay, so if you encounter there's an implant that is, that is dislodged from the patient. Okay, so what are something about asking for the safety, right? Do not select doubling of the gloves. All right, so for example, wear two gloves. Okay, so that is incorrect. Okay, so your intervention should focus on this STT. So there should be, okay, a distance, okay, the time, okay, and the shield. Okay, even if you double the gloves. Okay, so that is considered as unsafe, right? Okay, and it's very, very important when your patient is in this radiation therapy. Yes, we will place a patient in private room. Very good. We will place a patient in private room. Okay, what else? Okay, and of course, we'll post a caution that there is a radioactive material sign on the door. Take note of that one. What else? Okay, keep the door closed at all times. Okay, keep, okay, the door closed at all times. All right. What else? Another consideration. Okay. Okay. Can a pregnant, okay, visit, okay, can a pregnant visit po ba? No pregnant visitor ha. No pregnant. Okay, no pregnant visitor. Okay. What else? Children. Okay, no children under 16. Okay, no children. Okay, under 16 years old is allowed inside. Okay, take note of this one. Limit visitors 30 minutes and keep them at least 6 feet away from the source. Okay, question. Okay, so what if the radioactive implant is dislodged? What are you going to do? Very good, Isaiah. Okay, so pregnant women and children should avoid going there. Okay, yes, very good. Okay, so what if the implant or the radioactive implant is dislodged? What is your initial nursing action? Okay, just in case that there is dislodgement, what is your initial nursing action? Okay, dislodgement, right? So what is your initial nursing action? Okay, I'll wait for your answer. This is a trending NCLEX question, right? Mm-hmm. Oh, what is your answer here? Okay, during dislodgement, yes, radioactive implant is dislodged. What is your priority or initial action? Anyone during dislodgement? Okay, are you going to touch that implant with your bare hands? No, never touch it with your bare hands, ha? Very good, Isaac. Long forceps should use to lift it and place it into a lead container. Exactly, that is the correct action. That is your priority action. Use a long-handled forceps and place it into a lead container, right? So to prevent dislodgement, so our focus here is to prevent dislodgement. And how are you going to prevent dislodgement? Anyone? Okay, our focus is prevent dislodgement. Okay, how are you going to prevent dislodgement? Anything that reflects what? Anything that reflects that the patient will not ambulate, yes or no? Yes, okay, example. Can you give example? Anyone? Anyone? Okay, to prevent dislodgement, NCLEX loves to ask about this. Okay, so what are the action to prevent dislodgement? Anyone? Okay, so we will place the patient in what? We will place in the patient. Okay, okay, so meaning, yes, any action, okay, that reflects what? The patient will not ambulate. Take note of this, of that one, ha. Any action that the patient will not ambulate po. Right? So place all the equipment or place all the things of the patient within his or her reach. Okay, so what else? Anyone? Okay, how about the others? Can you please type your answer here in our chat box? Actually, the answer is already here in front of you, right? Okay, how about the others? Okay, how about for positioning of your patient, okay? Mm-hmm. Yes, we will place the patient in complete bed rest. Very good. Okay, so anything that reflects that the patient will not ambulate. Placing the patient in complete bed rest. Take note of this one. Another one are positioning of your patient. Yes, you can also do log rolling. Log rolling. All right. Okay. So, you can also, perform or insert, catheter. Yes, catheterization, indwelling Foley catheter, offer bedpan, something like that. No? Okay. What else? Okay. For the diet. Okay. This one is previous question. Okay. So for the diet, can we give? Okay. So what is your option? Is it a low fiber or high fiber diet? Okay. What is the diet of this patient? Is it a low fiber or high fiber diet? Anyone? You will just think that the patient will not ambulate. Okay. What is the best option for the diet? Is it, yes, a low fiber or a high fiber diet? Anyone? Okay. So okay, we will give a low fiber. Very good. Anything that reflects a low fiber diet, yes, diba? Very, very important. And as prescribed, okay, the HCP, yes, can prescribe antidiarrheals. Okay, antidiarrheals. Okay, a previous NCLEX question, okay? Ayan. So one of the option before is the cheeseburger. Okay, this is the correct answer. Why? Because we all know the cheeseburger is, yes, high in protein, right? High in protein. So this is the best option. Okay, anything that reflects a low fiber. So that is the best option. So we'll just think of, okay, the situation or scenario that reflects, okay, that the patient will not ambulate to prevent dislodgement. That would be the best answer. Okay, take note of that one. All right. Okay, now let's proceed to radiation safety. Okay, so we have talked earlier that we have here the factors affecting the radiation exposure. Okay, it's very important to maintain the distance, Okay, yes, 6 feet. Okay, 6 feet or more. Why? Okay, because this one might lead to what we call radiation toxicity. Okay, can you still remember your radiation toxicity? Anyone? Yes, because radiation, okay, affects not only the tumor but also nearby normal tissue. Okay, very good. Okay, if of course the affectation is the skin, this one will lead to what? Okay, redness. Yes, erythema. Okay, erythema. What else? Yes, okay, you will notice that there is desquamation or what we call peeling. Yes, desquamation or what we call peeling, no? Okay, the hair can be affected as well. Okay, alopecia. This one might lead to alopecia. Okay, and there will be, alteration in taste or your dysgeusia, right? Your dysgeusia or alteration in taste. Okay, when it comes to the taste, right? What else? How about for the mouth? Okay, toxicity in the mouth that might result to stomatitis. Very good. So expect, yes, stomatitis. What else? Okay, dry mouth or serostomia. Having a dry mouth, yes. Having a dry mouth, okay? And if, of course, the bone marrow is affected, okay, that might lead to bone marrow suppression. Okay, bone marrow suppression. Okay, can you still remember? Okay, huh? Okay, the site of your hematopoiesis. When we talk about of your hematopoiesis in your hematologic nursing, okay, so, okay, yes, the site of your hematopoiesis is the bone marrow, right? And when we talk about of your hematopoiesis, the process of blood cell formation, okay? And there's big things when it comes to your blood cell formation, okay? So we have your RBC, your WBC, your platelets. Can you still remember? Yes. So these are the major, cellular blood components, okay? RBC, WBC, and platelets, right? So it was says here, okay, for your radiation toxicity, there will be a bone marrow suppression. So meaning we're expecting that everything is suppressed. Everything is low when it comes to RBC, okay, WBC, and platelets. So we are expecting if there is decrease in the RBC, yes, okay, we're expecting, yes, anemia. So meaning, yes, our focus is anemia management because there is anemia. Okay, decrease in the WBC, okay, risk of infection, your neutropenia, okay, your neutropenia. Okay, so that is why we will implement neutropenic precaution, right? Next, we also have here decrease in the platelet count or decrease in your, yes, okay, your thrombocytes, right? It has something to do with the blood clotting, so we're expecting, yes, a risk for bleeding here. We're expecting a risk for bleeding. So bleeding precaution or bleeding management, right? So take note of this one for your radiation toxicity. So that is why our focus is what? Okay, your STD. Okay, so these are, yes, the factors affecting the radiation exposure, okay, to avoid this radiation toxicity. Okay, the proper shielding, okay, the time and the distance. All right, take note of that one. Okay, big things, okay, on your upcoming NCLEX RN examination. All right, let me just check our chat box here. All right, okay. So again, just to make a recap, for our external radiation, always think of what? Skincare and protecting the treatment markings, okay? It should not be removed, For your internal radiation, your topmost priorities are very good, your STD, right? And visitor restriction as well. If the question ask for priority, it will be most related to the safety of your patient, protecting both the client and the healthcare team as well. Right? Okay, we will not, yes, assign a pregnant, for example, a pregnant nurse, no? So it's a big no-no to assign the pregnant nurse, okay, to a patient with implant. Okay, it's a big no-no, Okay, so if you remember these principles, you'll be able to handle, Yes, very good. Almost any NCLEX questions related to your radiation therapy. And it's a promise. You will encounter this on your upcoming NCLEX RN examination. And of course, in the real world, right? Okay. Sige. Okay, very timely. So before we wrap up tonight's AMN Academy show, I love to hear from you, my dear future SRNs. So type here in our chat box, ha? Okay, sige. Okay, so I have a question. I love to hear from you, my dear future SRNs. So what's one NCLEX tip or key takeaway you're bringing home? Okay, you're bringing home from our discussion on cancer surgery in radiation therapy. Type your answer here in our chat box, right? So what is your key takeaways, okay, for our today's session? Okay, so type it, yes, type here in the comments now. Sige, I'll wait. Okay. Hello, Isaac. Okay, Sean is here. Okay, so what's your key takeaway on today's session? Okay, type it in the comments now. Right? Of course, your answer might even help someone else who's reviewing for the exam, right? Okay. All right. So maybe there's a bit of delay, right? Okay. Sige. So, if you found today's session helpful, so please share this live stream, okay, with your fellow NCLEX takers so we can help more nurses prepare and pass. Okay. Ravina, hello. Okay. Hoy, balik na nga rin sa Pasig. Okay. Hello, Ravina. How are you? Okay. And don't forget, my dear future SRNs, if you're ready to start your US nursing journey, okay, so it's very important to what huy, visit amnhealthcare.com/international and apply today. All right, so I think this is the end of our session, and this has been Christina from iPass Processing. Okay, for the AMN Academy show. Thank you for spending your evening with me. Right, so keep studying smart, and I'll see you in our next trending NCLEX topic session. Good night, everyone. Have a great day. Bye.